Hi everyone, my name is Nompumelelo Prudence Kubheka. I'm a clinical psychologist and also a traditional healer. My practice is called NPK Clinical Psychologist. It's based in Mondio in Joburg South, and you can also follow me on Instagram at NPK _ clinical psychologist, and yeah, so you can get most of the information there. So I'm both, and my process started from a long time ago. It didn't just start like when I went through my process of Ukutwas. I've always known that I was a gifted person, and I think that I started getting sick second year of masters. So I did my masters at the University of Pretoria, and I started getting sick then, second year of masters, and I knew that now it was time for me to go through my process of Ukutwasa. Funny enough, I was already someone that was journaling about my process and understanding it better, because that's the time that I got sick, and that's the time that my gift was mature enough that now it needed to be acknowledged more and have me go through the process so I can be a traditional healer. I studied at the University of Johannesburg. I did my undergrad and BSc Human Physiology and Psychology, and then I did my honors at the University of Johannesburg as well in psychology, and then I went to do my masters at UP. I think one thing that I'm grateful for is that even though there wasn't so much understanding when it comes to my process, I think I got much support from my supervisors and my lecturers there. And I think people don't understand how much of a person acknowledging what is happening with you and the emotional consistency when it comes to support, it goes such a long way. And I'm very grateful for that I wasn't discriminated against. Instead of that, people tried to understand me. I then went to do my internship at Vescopis in Pretoria, and even there, like, people were amazing because I had a whole lot of beads. I was going through my process and it was a lot. And people and my friends then were very understanding, and colleagues were very understanding, and even the supervisors there. So I'm grateful for that as well. And then I graduated as a clinical psychologist and a traditional healer at the same time, you know, in the same, not at the same time, but in the same month, in the same year. And I always say, like, both were not a coincidence. It was more of a gift that needed to be appreciated and needed just a few steps for it to get to where it is now. So now I understand what the context of that is. I think going to the advantages of me being a healer or being a dual healer is that most people, what they don't understand, they disregard, but I've also learned to understand my boundaries and also own the space of my existence when it comes to that. So I own my gift fully as much as I own my profession, and that's how I have introduced myself. You can never get to know Nompumelelo without knowing that she's a traditional healer, and also not knowing that she is a psychologist, but I'm a traditional healer before I'm a psychologist. Being a dual healer as well also comes with a lot, because what happens is I get to feel a lot. I know that we learn about counter-transference and transference, but for a gifted person, it goes beyond that. It goes beyond that, from like your body pains and all of that, and the energies in the room, and just seeing someone's future and all of that. And even in the practice, even though I can't speak about it most of the time, but it doesn't mean that some of the things I won't see. But I think spiritual maturity is also being able to understand that sometimes the stuff that you see are none of your business. But I've also learned that with the scope of practice, in being a psychologist, to get more information from someone and also acknowledge both things, is I am able to then ask questions in terms of, like, let's think about someone that has lost their grandmother, and then I start to see their grandmother in the office. What I would then do automatically, I don't know how it happens, but they would start speaking about their grandmother. And just to acknowledge that, I would not say your grandmother is here because I'm a therapist. So what would happen then, I would say, do you feel like your grandmother is always with you? In that way, I'm acknowledging the patient's emotions while I'm also acknowledging the spirit that is in the room. The only disadvantage for being a dual healer is the fact that the scope of practice is mostly based on Freudian theory. And if you look at the psychosocial, the psychosexual development of Freud's theory, and also if you look at Jung, you get to understand that even though Freud understood the human in us, but he didn't look at us holistically. And then what happened is he looked at so much of the sexual and aggression that he forgot about the spiritual part of a person. And then what happens is that is suppressed. And if you look at the scope of practice, is mostly based on Freudian theory. So this then, or on psychoanalysis or psychodynamics, then it pushes some of the things to the side where it comes to a person's spirituality. So sometimes I honestly feel that as much as I'm able to conceptualize the patient with psychodynamic and psychoanalysis, because that's how I was trained, but I also feel like there's certain elements that I'm missing when it comes to that. What I then did, I explored Carl Jung, which I love so much, and he understands on how the collective unconscious can also relate to our ancestors' memories and how we end up having the same practices or intergenerational traumas because of that, which brings the ancestors, you know. So I fall more now into Jung's theory than I do in psychodynamics, and I'm still appreciative of the process that I went through in terms of becoming the psychologist that I am today. But I think it's more of a combination for me, because for me it feels like Freud suppressed the spiritual part of things while Jung embraced it. Conflict, I think that's the only conflict for me when it comes to the spiritual stuff. I prefer to work more with traditional cases. I feel like as a traditional healer, I can be more of myself. You know, I don't have to be anything than Nompumelelo or Gogo in that space, you know, and how it also allows me to, when someone in the olden days, what happened is, in the rural areas, which is still happening now, is that traditional healers were seen as people that were able to connect, which is the truth, but they also were seen as cancelers, because now, as much as I'm so young, I also carry old knowledge, and that's why I'm called Gogo, because I carry old knowledge that can also help others. And I can easily connect to the spirit that can also give people guidance on what they need. So in the traditional part of my practice, the traditional practice is that I'm able to actually still be holistic in that space where I can freely be able to say, you know what, your grandmother is saying this and this and this, and you need to do this and this and this, and we're going to start with this and this and this, which is very different from being a psychologist. So what happens in the NPK practice is that people come and tell me information about themselves, and we work with that. In the traditional practice, I then connect with their ancestors to tell them stuff about themselves, and then we work with that, you know. So I honestly have learned, because I've been both for so long, I've learned to embrace both, and because they happen simultaneously, it's hard for me to separate the two sometimes, but I'm more a traditional healer than I can be a psychologist. Well, I am a psychologist, but I'm more on the traditional healing side. I feel like it becomes more of me, and it's my safe space as well. It also feeds me, you know. It's not just about my patients, like it's not something that is always like patient-centered. So the same practices I can also use on myself so that I'm also centered, you know. So it's my very safe space. What is the next question? yes, so it's my safe space. With individual therapy, I find that in my practice, I get a lot of people that are spiritually gifted, and there is an understanding when someone says to me, I dreamt of this type of ancestor, I'm able to understand without having to ask, what does this mean, and all of that. So the relation in that, so the knowledge of me being a healer also helps me, because I get to understand when someone comes and says, I'm going through my Twasa process, or I've had this dream, and all of that. Another difference is, I know that Carl Jung has a book about dreams. I know that Freud also interprets dreams. But with also being a healer is that when someone tells you the dream, in my mind, I can already, like in my thoughts, I've already been told on what this dream means. But then what happens is, because in spaces where I'm a psychologist, I have to stick to the scope of practice. So I would ask, what do you think this dream? Analyze it psychologically before I get, and then if ever it gets to the spiritual part, then great. But if it doesn't, we look at it like that. And then with being a healer, I can just freely, a traditional healer can just freely speak about the dream, to say, actually, this dream means this and this and this. How does this compare to mental stigma, you know? Okay, so are there any patients that are hesitant to seek traditional help? Definitely, yes. Remember that we are raised with different beliefs, you know, and there are people that are hesitant, and I think it's how also it has been portrayed, you know, whether in social media, whether in television and all of that. It is made to be scary when it's actually not so scary, you know. So I think, yes, there are people that are very hesitant when it comes to going to traditional healers. It's seen as something dark, and I think it also comes from the fact on the Witchcraft Suppression Act and colonization, on how we were told that whatever our practices are not the ones, and traditional healers were killed and all of that, and how now this was used as a witch doctor is actually someone that is bad. Like, it's looking, even just the fact of using muti is seen as something bad, and muti is the herbs that we also have in our panados and all of that. It's just that the traditional healers use them at their raw form, you know, because yeah, they use them at their raw form. But I think that, yes, there are people that are hesitant in it, and I'm not even offended by it, because I feel like there needs to be respect when it comes to people's beliefs, whether they are Christian, Muslim, African Christianity and all of that. So definitely there is, I feel like there's a lot of work that still needs to be done to decolonize that. How does this compare to the mental health stigma of going to a psychologist? Psychology is a Western profession, was, because now there's us, so see us, we are here. No, psychology is, I feel like there's more stigma in traditional healing than it is in psychology. I feel like people would rather speak about going to a psychologist than going to a traditional healer. There's so many people that would even say, I don't want people seeing that I came to see you, especially in my traditional ancestral house, because I work in different locations. So they would say, I don't want people to see that I've came here and all of that, you know. I think that with mental health, it has become so open that people are able to speak about it now, and even with traditional healing. But I think that there's so much work that still needs to be done, but definitely people are more ashamed to say I'm going to. Actually, they're ashamed of saying I'm going to both. The professions we choose, yes, they are scared of saying I'm going to both, but traditional healing is the worst. What does this mean? So decolonization of psychology is gaining massive. So what does this mean for African traditional healing? I feel that it means that we are getting our space, you know. I think it means that I feel like we still have a long way to go, but it means that we are getting our space. We finally being seen. And I like on how ancestors are. I feel like they are very clever on now having to introduce themselves in higher educations, because that's where my callings matured to a point that I had to go TWASA and all of that. So it means that there's so much that needs to change, you know, especially the scope of practice. Do you think the youth would start consulting? They consult already. So the youth does consult with traditional healers, and I feel like we, the millennials, are the youth that are also bringing back the African traditions and taking it to where it used to be, to the grounds where now we are embracing the existence of our ancestors without being ashamed of it, you know. So I'm liking that. Do you think closing the gap between psychology and African traditional system has a potential to heal? Oh, definitely. The past, yes. I definitely think so. I feel like for me, Carl Jung is the person, guys. And why I say that is because he saw this even from a long time ago, and even as a white person, he saw it and he embraced it for what it is. And I think the gap definitely can be closed when it comes to that. But there's so much hurt. Remember that if ever we are dealing with the healing of ancestors, we also have to deal with apartheid and colonization and all of that trauma that resulted in people being introduced to a different religion and some certain spiritualities being suppressed. So there's so much that still needs to be worked on when it comes to that. Do you think it's important to incorporate the study of African belief system into the South African Definitely, I agree. You know, I think that I like that we are having that now. I think it's very, very important, more especially because most of interns and also comserves end up in hospitals that have people that are Black and people that have certain cultures that are different. And I remember when I was doing my comserve in a certain hospital on how the other race, white people, couldn't understand, and also other races couldn't understand what was happening with patients. And it's so easy to go to the DSM and get to a diagnosis of what this is, but have you explored it enough to understand what it is? Because sometimes you could think that it's psychosis, but it's not. I'm gifted and I hear voices and I see visuals and I see visions, and it's not hallucinations. It is a gift because it is accurate, and not according to my culture, but it is accurate. But then if ever you have not learned this, even in university and all of that, it's so easy to get to a point of saying, actually, this is a mental illness, which could actually be not. Are there any other ways that psychology students can become culturally sensitive and competent? I think doing your own research when it comes to the cultural stuff. I wrote my thesis on the psychological perspective on the Zulu ancestral calling. So if you look online, you can also find that. If you search my name, you can find that online, my thesis. I think also when you haven't, as students, we are told that you need to meet yourself in a deep place so that you are able to take your patients there. So I think also understanding your own spirituality and religion, whatever it is, can also help you to understand someone else's religion and spirituality. In my practice, my psychological practice, I don't only work with traditional healers. I work with born-again Christians that know that I'm a traditional healer. I work with Muslims, I work with different religions, but the main thing as I've started is that it's more about embracing and also being emotionally present and supporting something that you are not understanding, but also not disregarding. When you do that, it's also important to attend a lot of courses, like I do workshops yearly where I speak about ancestors and I speak about understanding both. So I think it's important for you to educate yourself when it comes to that. I also have a podcast that I speak about this a lot. It's called At Rooted Chats. When you search for it on Instagram, it's called At Rooted Chats, and you can also find it on YouTube. It's called Rooted Chats, where we have different types of conversations, and sometimes I do speak about my spirituality. I'm more in a space of being private about the practices and all of that, and some of the things, because of my own boundaries and my own self-preservations, there's things that I won't share there, but it's important that you also learn about your history and was there anyone that was gifted and all of that. And the most important thing about when you see patients is to understand a patient more than to judge a patient. So I think once you start to learn about different cultures and be open-minded, you will then get to understand that people are fed by whatever centers them. Sometimes whatever centers someone is something that you don't understand, but it's more about, when you're a therapist, to understand it so that you are able to help the patient. When you understand it, it doesn't mean you make it your own, but it's more about, I'm understanding it because this is my job, and this is how I also want to help connect with my patients. All right, so thank you so much for watching this. I hope that this was informative, and yeah, thank you. Bye.
Khanya lisedi, amakuthokozane, makhosi makwande. That greeting simply means the God in me, the ancestors I work with, honor the God and the ancestors in you. My name is Xoliswa Ngizalwa kaMtolo, nakwantambama kisihlolo sabatawung isiZulu ebathenjini. I'm a traditional healer, a spiritual healer, also a student studying towards a communications degree. I worked in corporate for a number of years, and around about 2015-16, I started feeling unwell. I'd always been a child that would have dreams, a child that was sickly, but not really fully understanding or connecting it to a spiritual core. It was around about this time, 2015, that the dreams I was having, the visions I was having, started to heighten, and the unwellness. The reason I'm saying heighten is because a calling is something you're born with. It's a gift. You come with this gift. It just sometimes lies dormant up until later in life. When I was in corporate, the visions just got worse. The dreams got worse. I was unwell. I was not sleeping well. And that's when I decided, no, let me look at things from a spiritual perspective. And that was when it was confirmed that I'm actually experiencing an awakening. In the times that we are living in, we are seeing a lot of awakening happening around us. For the longest of time, the issue of spiritual healers or traditional healers was taboo, because we come from a society that was majority Christian, and we have always heard of taking care of ourselves mentally and physically, but never spiritually. And now we are seeing that we are needing to approach healing in a holistic manner. What I mean when I say holistic healing, I mean mentally, are you well? Psychologically, are you well? Physically, are you well? Spiritually, are you well? That is where now spiritual healers, that is where we come in. We see that more and more people are having an awakening in this ancestral call, but most people still do not understand what exactly this ancestral call is and what it looks like. Spirit is energy, and spirit is not tangible, and most things when it comes to spirit are not logical. They do not make sense, and therefore they are misunderstood. When someone is experiencing an ancestral calling, that person is in most cases the only person that really is feeling what they are feeling, or seeing what they are seeing, or hearing what they are hearing. Now, it is very easy for some of these symptoms to be misdiagnosed or misinterpreted by the medical side of things, the medical practitioners. If you look at the symptoms, they tend to be very, very, very similar. Headaches, insomnia, lack of sleep or oversleeping, back aches, waist aches, ear aches, pain in the legs, the joints, mood swings, seizures, epilepsy, sometimes even blackouts. Now, it's very easy for medical practitioners to just say, oh, it's a migraine, oh, it's bipolar, it's schizophrenia, it's hallucinations, it's just medical seizures, it's depression, it's insomnia, and so on. If we do not get to a point where we are working together, we miss that opportunity of helping patients holistically and successfully, and in a shorter space of time. And so when I talk about collaboration, I'm simply saying there is no better sector or better side. There is no competition, but rather we need to come together and complement each other. Me understanding my role as a healer, as traditional healer, understanding that my role is to hold space for ritual. My role is to hold space for ceremonies. My role is to teach and make people understand the importance of rite of passages and how they are then performed. My role is to heal spirits that are restless, is to heal spirits that are awakening. It is to heal ancestors. It is to help heal traumas that are being experienced, but that are generational traumas. It does not take away from the role of a medical practitioner, because this awakening is something that is somewhat a shock to the system, a shock to the mind. You would find that most patients would really also start manifesting illnesses and sicknesses that need physicians, that the call sometimes is so overwhelming that the patient needs psychological or therapy. They need that type of help. With other people, they even need the medication that is provided by the health side of things. However, with other patients, they have developed those illnesses as a result of unsettled spirits. They are needing to be aligned, to be grounded. These spirits are needing some type of either a ritual or some type of intervention to help them heal and to help align this person, this body, this human being that they have found chosen a house in, so that this person awakens to their purpose, that this person awakens to their call of being healed. Now, the process of initiation in itself is a very, very challenging and a tough one. It is a process that is also traumatic. It is a process that for anyone going through it, they do need continuous therapy, continuous counseling, because it becomes overwhelming. There is a lot of shedding that happens during initiation. There is a lot of trauma that is being revealed, not just your own trauma, but traumas from the previous generations, from your ancestors. And there are shadows that come up as you are being initiated, as you are, because it is also a rebirth of some sort, as you awaken that healer within you, as you shed off the old, and you are coming into this new knowing of who you are. And it is advisable that people going into initiation get that counseling or that guidance even before they go into the journey or into this process, during the process, and even post the process. It is important that health workers and healers work hand in hand with patients in order for me to see, okay, this is a spiritual thing, this is what I can do and I will do to make the spirits well. But this, I know this is my jurisdiction, this is how far I can go, but this is purely medical. It is important for healers to be honest and fair, for people to approach well-trained healers who understand what spirits are and how to work with spirits, but who also are fair and honest enough to say, this is not a spiritual matter, this is not a spiritual issue, let me refer you, rather go this route. Just as it is important for medical practitioners to say, we have tried, we are trying everything, even with the medication, even with this, we are not able to get to the point of what is troubling you. Can I then refer you to someone, to a spiritual healer, to see if whatever that is needed is not something that is spiritual? In that way, I know my role. I know how to empower this person to say, you know, if you have a call, you would sometimes get headaches, but it is because spirit is trying to communicate something. You would get palpitations or panic attacks or an anxiety, but that is a spirit that is active, a spirit that is trying to communicate something, a spirit that is present at that particular moment. To be able to say, do this when spirit is activated to calm yourself down. Do this when you feel this to ground yourself. Do this when you are in a work environment to ground spirit and to align yourself. Do this to vibrate high when you feel like your mood levels are fluctuating, but not discarding any need for medical attention if there is. Hence, I'm saying that working together, working hand in hand is very key. Now, there is a lot of written research and information on socials that medical practitioners can now access and trying to understand the traditional side and the spiritual side of things. But that does not take away from the value of human contact, the value of finding somebody who is a spiritual worker, a spiritual practitioner to work with, to talk to in order for you to understand people that have a spiritual call as well as a mental condition, or to be able to know how to differentiate if no, now this needs a spiritual person, to see how traditional healers or spiritual healers handle and deal with somebody whose spirits are active, and to actually see what the patients go through when spirit is active. It is very, very important that we understand that we are not competing with each other, but rather we are needing to work together, to work together to come up with even new ways of handling patients for the good of the patients. It is important to know that we are there to complement each other. We living in a country that has a very traumatic history, hence the social ills and the trauma and the depression and the suicide rates that we are seeing. It is as a result as well, amongst other things, of traumas and pains that were not addressed, that are not being discussed, those difficult conversations, the stigmas that we are not discussing around our differences and our diversity as a country. It is imperative that we get to a point where we are saying, how can healers help cleanse, even at a national level? How can healers help in healing even the soil that we live in, even the nature that surrounds us, because we are body, mind, and soul, but we are spirit that is constantly vibrating, and everything is interlinked and connected. What is then our role? Because healers izangoma, even in the olden days, were scientists and are scientists in their own rights. There are cosmologists in their own rights. There are doctors in their own right. It's just that with our sector, it is, you don't find textbooks, you don't find a curriculum, because you are dealing with energy, you are dealing with spirit, you are dealing with something that is not tangible. But we need that healing at that level in order for us to break free from all the sufferings that we are seeing in our country. We need this collaboration for us to get to a level of lessening all these other ills that we are seeing, social unwellness, even to financial unwellness. Because if you are not well mentally, either as a result of a medical condition or a spiritual condition, you are less productive. And so now it has a ripple effect on all areas of our lives. Also, we live in a time where there are, unfortunately, spiritual narcissists, fake prophets and fake healers, and this puts patients in danger. And it is important that I also ask people to pay attention to red flags. It is important for people not to wait for things to get out of hand or out of control before seeking help in terms of balancing all these areas of their lives. Because once you are in a desperate position, the first door you walk in, you will basically listen and take everything that you are told there. You will miss the red flags. You will not be in a state where you can say, but this feels like it's too good to be true. And it probably is. This does not feel right. I am feeling pressured here. I am being asked to perform in rituals or to do ceremonies that I don't understand. I am being told that I have an ancestral call. When you don't have an ancestral call, and maybe you are really sick, needing medical assistance or medical intervention. So it's very important for people to know that not all that glitters is gold. People may look presentable, people may speak well and make sense because they are experienced and they know the spirit world and they know how to manipulate people and they know how to brainwash people and they know how to blackmail people. So it's very important because some people are actually walking right into harm as opposed to healing. And by the time you realize that no, this was not it, you have now accumulated and called in more dark energy towards yourself, more accumulated, more trauma than even before. So especially those that suspect or think that they have a spiritual call, make sure that medically you are cleared, but there's still something that is not well. Then consult. But when you consult, do not be afraid to ask questions. Make sure that you understand everything that is being said to you. Make sure that you know what questions to ask as you go into consultation, especially after being told that you have an ancestral call. Even when you know that yes, you do have an ancestral call, do not rush into anything. Divine Spirit is patient. Divine Spirit does not impose. It does not seek to harm us. Anything that infringes on your human rights, anything that infringes on your spiritual independence is not of divine, is not of the divine. So it is also important to also ask God, your higher self and creator, if is this in alignment to you? Is this in alignment to light? Because what traditional healers are, they are light workers. They are meant to bring healing, not more harm, not to destroy and not to tear apart. So it is important that you make sure that you do not get into a process and after that you find that you have acquired addictions and you are more confused and you are more sick. And it is also very important to know that getting spiritual healing, if you are somebody that is on chronic medication, does not mean that now you stop taking the chronic medication. If you are somebody that is healing medically from something, it does not say now stop doing that. And some people, what they would be experiencing in their lives is a manifestation of the ancestral calling, and you will see if those things start healing as you are going through the process of healing spiritually. But it is not everybody. It is still very important to have a physician, to have a psychologist, to have a therapist, to have a counselor, because what we are looking at now is approaching people and teaching people and guiding people to a point of being healed holistically in all their areas. Healing is a process. There are no shortcuts. Be very careful of instant results, miracles, miraculous solutions, and promises and all of that. Because sometimes people actually go into things that are not of divine light. There is what we call a false light. So we need to be very, very careful, because if we don't pay attention, if we are not alert and we do not cultivate that spirit of discernment, then we will be left with more people that are needing psychological help, therapy, and all of that. People that now would really be hallucinating. People now will have acquired spirits that were not spirits that needed to be initiated to become healers or for whatever reason. So it's very important to know that we live in a world of dualities. Not everything is as it seems. So it's very important. Also, if you feel there are a lot of psychologists and therapists that have the calling and that also have initiated, that understand the spiritual side of things, if then that gives you more comfort, then those are the people you should be seeking help from. And again, I still say that it is important for health practitioners, medical health practitioners, and healers, traditional healers, to work hand in hand. Some patients need that. They need that you work with both systems at the same time and get the counseling pre-initiation, during initiation, post-initiation. Get the medical help that you are needing pre, during, and post. And take care of yourself, because as I heal, as you heal as an individual, you heal a family. As you heal your lineage, as you clear the residue and the trauma in your ancestry, in your bloodline, you are healing your ancestors. And as we do that, we heal our nation, we heal our communities, and we ensure that our descendants don't have to start from point zero. And thank you so much for listening. I wish you love and light and healing. Khanya.